This week, we reached a tragic new mark of 900,000 deaths in this country from COVID-19. Each week, I share with you the burden of disease in the United States, including case counts, hospital admissions, and the number of deaths. Much of the data I readily share is because we have made huge strides in our ability to effectively monitor this virus. And new tools allow us to prepare and react to an evolving virus and inform response measures in near real time. Today, I'd like to walk you through just a few of the layers of surveillance we have in place, some that we have been expanding and developing over the past 2 years, and others that are bedrocks of our public health work. Let's start at the local community level, where our biggest question is, can we quickly identify spikes in cases? As people with COVID-19 shed the virus, testing in wastewater or our sewage systems can help us monitor COVID-19 in communities and provide an early warning of increased COVID-19 cases to help communities prepare. Last week, CDC publicly released national wastewater surveillance data, tracking more than 400 testing sites across the country in 212 communities, which we will double to more than 800 testing sites in the next 4 weeks. On this map, you can see the testing sites that we monitor and trends in the levels of the virus. Communities in blue have decreasing levels of virus, while communities in red and orange have increasing levels. This is a powerful tool that, when paired with traditional public health surveillance, can help us identify where the disease is spreading and how best to distribute resources. We've also made significant progress in syndromic surveillance, defined by the ability to identify symptoms and cases that are suggestive of COVID-19 disease. Through syndromic surveillance, we can answer questions about disease severity and patient populations with the highest burdens of disease, crucial information to inform guidance and prevention measures. More than 6,000 healthcare facilities across the country, representing over 70% of emergency departments, contribute data to our syndromic surveillance and help us understand where and how the virus is having an impact. In addition to monitoring where the virus is and how disease presents in the community, our genomic surveillance can quickly identify variants so that we can understand their impact. Each week, CDC analyzes genomic sequences from all 50 states and uses these sequences to understand the spread of variants across the country. On this slide, you can see the projections of variant proportions for the last 14 weeks. Omicron, shown in pink and purple, now represents nearly 100% of viruses circulating in the United States. Our cohort studies and state-level surveillance data provide detailed and regular reports of how our vaccines are working in the real world among diverse populations, giving us faster and better data to know that our vaccines are working against new and emerging variants. You've heard me discuss many of these platforms before, like our hospital surveillance through CDC's COVIDNet and Ivy, our collaboration with 7 integrated healthcare and public health research centers through Vision. Surveillance of infection is essential in frontline workers in Heroes Recover, and our nationwide surveillance of vaccine effectiveness in children and young adults in overcoming COVID-19. Taken together, these studies provide us an in-depth and comprehensive understanding of how vaccines are working with participations in sites nationwide. And importantly, COVID-19 vaccines are being administered under the most intensive vaccine safety monitoring effort in the United States history. Our nationwide vaccine safety networks, such as vSafe, which provides personalized and confidential health check-ins via text message, and other systems such as VAERS, the Clinical Immunization Safety Project, and the Vaccine Safety Data Link, empower us with the data of any rare side effects or reactions after vaccination or boosting. This is a huge amount of data. CDC, along with our partners across government, state and local jurisdictions, academia, and healthcare, has cast a wide and comprehensive net over the country to follow the virus and its impacts in real time. And we will continue these data as our using these data as our guiding source as we look to what comes next. I know there will come a time when we move from a phase of crisis to a point where COVID-19 is not disrupting our daily lives. And as we all look forward to this next step, I want to instill in everyone that moving forward from this pandemic will be a process that's led by our surveillance and our data. I'm confident that CDC and our public health partners are well positioned to lead the way. Thank you. And now with that, I will turn things back over to you, Jeff.
Thanks, Dr. Walensky. Now let's move to booster shots. We know that there are a number of different ways to view progress on boosters, depending on which data set you're looking at. For example, some people assess boosters as a proportion of all adults who are fully vaccinated, while others look at the total U.S. adult population, even though not every adult is eligible for a booster shot yet. So before I turn to Dr. Fauci on the effectiveness of booster shots, I want to review how we assess the available data and use the best available data to measure the progress we're making on getting people booster shots. CDC data aggregated from state health departments shows that more than 90 million booster shots have been administered. We know that that is likely undercounted, as some people reported their booster as a first shot and others forgot their vaccination card altogether. States have been matching data and have encountered some challenges across different channels, which has led to delayed reporting for booster shots in many states. CDC is working with states to address these issues to improve the data. At the same time, CDC conducts a weekly survey, which is a nationally representative survey of over 16,000 adults. Looking at the CDC survey results, you get a more up-to-date picture of the progress we're making on boosters. Based on the latest CDC survey, we estimate over 2/3 of all eligible adults and over 80% of all eligible seniors, those most at risk and most vulnerable, have received a booster shot. CDC survey results are consistent with the Kaiser Family Foundation survey, which shows 70% of eligible adults report they've gotten a booster. So we have a strong foundation to build on, with most eligible adults boosted. In fact, we estimate at least 2 out of 3 eligible adults in the U.S. are now boosted. 2 out of 3 eligible adult Americans with a booster shot. And across the last 2 months, we've made important strides on equity, with the majority of booster shots going to people of color, in a very important improvement from the prior 2 months. The significant progress we made on boosters is one of the reasons why we were able to confront Omicron with fewer disruptions to schools and businesses than in prior surges. And we clearly need to keep driving this progress. So our message is clear. All eligible individuals should get their booster shot right away. Booster shots are free. They're available at 90,000 convenient locations across the country. And as Dr. Fauci will discuss, critical to getting people the highest level of protection. With that, over to you, Dr. Fauci.
Thank you very much, Jeff. What I'm going to do now over the next couple of minutes is to just build on what Jeff said and talk to you based on real data why it is so critically important to get booster shots. I'm going to talk about laboratory data, clinical trial data, and real-world data. Next slide. So there are multiple, and I can't show them all, in vitro studies that show that COVID-19 vaccine booster doses markedly increase the neutralization of variants, including what we're dealing with currently, namely Omicron. Next slide. This is the slide that shows the genomic mean titer of antibody, namely the proteins that neutralize the virus. If you look at the far left-hand side of the slide, 7 months after people receive a second dose and before the booster, look how low the response is to Omicron, which is the bar that has the red circles. It's 23. 1 month after the booster, it goes way up into the highly protective zone of 850. And even 6 months after the booster, it is still at a high level of 136, way above what it was 7 months after the second dose. So that's representative laboratory data. Next slide. Now, a randomized controlled clinical trial showed the dramatic impact of the booster dose in preventing symptomatic disease. And the data are really striking. I'll show you one clip of that on the next slide. As you can see in red are individuals who've gotten 2 doses. It says placebo, but it's 2 doses without the booster. And this is a Pfizer study, but it really holds true with other products like Moderna. If you look at the result in blue of the cumulative incidence of COVID-19 following a booster shot, the difference is dramatic. Next slide. Now we'll move to real-world effectiveness studies showing that booster doses reconstitute the waning protection, especially against severe disease, hospitalization, and death. So next slide. So here we look at individuals less than 6 months after the second dose. And on the far left, you see when you're dealing with Delta, it's 90. When you're dealing with Omicron, it's 81. But more than 6 months after the second dose, it wanes with Omicron to 57, holding up a bit better with Delta. But after the third dose, you get protection at 90% with Omicron, which is even better than after 6 months after the second dose. Again, another example of the critical importance of boosting. Next slide. Here's another way of looking at it. When you look at symptomatic disease and hospitalizations, again, when you're dealing with Omicron on the far left, the protection against symptomatic disease is quite low at week 25 following 2 doses. If you look at the boost, it goes up substantially to 40%, but the critical data are on the right-hand part of the slide. If you look at hospitalizations and look at 2 doses of the Pfizer-BioNTech, either at 2 to 4 weeks or 10 to 14 weeks, it's still way up there at 75%. Next slide. And again, if you look at CDC data, which shows a dramatic reduction in the risk of hospitalization and death for people who received a booster dose, we can see that on the next slide. And this is a summary of data. If you compare a fully vaccinated person with one who has received a booster shot and look at the monthly rate of COVID-19 associated hospitalizations during a time frame of December 2021, there was a 45-fold higher likelihood of an unvaccinated person in the age range of 50 to 64 and a 51-fold higher likelihood of an unvaccinated age 65 and older of being hospitalized when you compare to an individual with a boost. Next slide. When you look at death rate, again, the data are really rather striking. If you look at unvaccinated in red and look at the death rate per 100,000 compared to a fully vaccinated person who's not been boosted, showing you why vaccinations, even without boost, are important. But look what the booster does. It brings back the death rate per 100,000 to a remarkably low level. So we can only come to one conclusion on the last slide, that COVID-19 vaccines, booster shots, can keep you out of the hospital and certainly can save your life.